Welcome to the class on Critical Thinking Applications, Medication Principles. Today's lecture is really going to cover the basic principles that you need to understand in order to safely administer medications in the clinical setting. I want you to take a moment and reflect on some things regarding medication administration that you're either concerned or anxious about, or that you're really excited about. Go ahead and pause the PowerPoint for a few seconds. Thank you. I'm going to review some of the things that students in the past have told me. So some of the things that they're usually anxious or concerned about regarding meds are making a mistake or hurting someone. Those are really the top two issues that students have brought up in the past. As a faculty member, I have to say that I feel better when my students are a little bit anxious about administering medications. To me, that little bit of anxiety is going to be what keeps you safe and what keeps your patient safe. I am much more worried about a student who is complacent and thinks that administering medications is nothing to really be worried about. Now, a few things students are typically excited about. The main one is that this really makes them feel like a nurse, that they are doing something proactively to help their patients get better. We're going to talk about a few of the main legal aspects of drug administration. One principle that I want you to really take away from this presentation is that as the nurse responsible for patient care, you are really the one who is the last line of defense. So a prescriber may write an incorrect order, but if you carry that order out, then you really are truly as responsible as the prescriber who wrote it. It's important that you understand the medications you're giving and whether or not they're appropriate, whether the dose is safe, and if any of those things are not the case, then you need to be the one who is able to stop that process before harm comes to the patient. In order to do that, you have to be able to question orders that seem unreasonable. So that means you have to understand what those orders are. In order to do that, you have to be knowledgeable about the medications that you're going to give. We're going to talk for a few seconds about a couple of different types of drugs. The first category we'll talk about are controlled substances. Basically, a controlled substance is a drug or substance whose manufacture, possession, or use is regulated by the government. These would include illicit drugs, but also include certain categories of prescription medications. We label these as different schedules. There are Schedule 1 through Schedule 5 drugs. Schedule 5 drugs would be those that contain limited quantities of narcotics. So, for example, a cough syrup that contains some codeine. That would be a Schedule 5 drug. And it goes up the scale all the way up to the Schedule 1s. Your Schedule 1s are substances that really have no accepted medical use. They're considered to be unsafe or hold a really high potential for addiction or abuse. Some of those would be like heroin, marijuana, LSD, ecstasy, those types of drugs. Another category I want to talk about are high alert drugs. High alert medications are usually drugs that bear a heightened risk of causing significant patient harm if they're used in error. So it doesn't mean necessarily that mistakes are common with these particular drugs. It just means that if a mistake happened, that the consequences could be devastating to the patient or their families. I have posted a link on Blackboard that takes you to, there's a link on your Blackboard course shell that will take you to a list of high alert drugs. Some of the common ones that you will see in the clinical setting would include heparin and other anticoagulant drugs. We'll talk about more of these as you proceed through the program. Next, we're going to identify the 7 parts of the physician order. For an order to be valid and legal, it has to contain 7 required components. Those components include the patient's name, the date and time the order was written, the name of the medication to be given, the dose of that medication, how often the medication should be administered, the route of administration, and then it must be signed by a physician or a prescriber. On the next slide, you're going to see an example of what an electronic medication administration record looks like. And I want you to see if you can locate some of those components. On the next slide, you're going to see an example of what a medication Next, we're going to talk about the 7 parts of a physician order. Next, we'll talk about the 7 parts of a physician's order. For an order to be legal or valid, it has to have all 7 components in place. The first is the patient's name, then the date and time that the order was initiated, the name of the medication, the dose of the medication, how often it should be administered, the route of administration, and then the signature of the prescriber. There are also 9 parts of a medication administration record. You're going to hear these referred to as MARs as you move through the program and in the clinical setting. A MAR is basically the document that you use in order to administer medications in the clinical setting. On the next slide, you're going to see an example of what a medication administration record, or MAR, looks like. These are the 9 components that you should be able to locate on that slide. It should always include the patient's name, their room number, their hospital ID number, and then the name of the medication, the time the medication is due, the dose of the med, the route of administration, a start-stop date, and any allergies that the patient may have. Here's an example of what an electronic medication administration record would look like. So, on the previous slide, we laid out what the 9 components were that need to be present. So, if you take a look at this particular example, you can see in the upper corner that you've got a name. In this instance, in the upper corner, you've got a patient name. In this one, it's Kit RX, because this is a simulated patient. This example of an EMAR is based upon a simulated patient profile. In the upper corner, you can see the patient's name, Kit RX. You can see the room number. Across the room is 2125. The hospital number is present across the top. The name of the medication as you scroll down. This is an example of a simulated MAR. This is an example of what a medication administration record, or MAR, would look like in the clinical setting. This particular MAR is based upon a simulated patient. We will look for the 9 components of the medication administration record that we discussed on the previous slide. If you look at the white bar going across the top, you will see that you can find the patient's name, Kit RX, the hospital number, starting with D000, the room number, D2125. Other information that's not part of the MAR itself are that you also see, however, that there's more information there. You have the patient's age and date of birth. You also have several other pieces of information on this particular MAR, including the patient's weight and body surface area. Moving down in red, you will see that the patient's allergies are noted. This particular simulated patient is allergic to iodine and cephalexin. This particular patient is allergic to iodine and cephalexin. If you look across the screen, also in red, you'll see that this patient also has adverse reactions. If you look across the screen, also in red, you'll note adverse reactions. This patient reacts adversely to aspirin and azithromycin. Moving down, you will now see the medications. On each one, you will see the name of the medication, the dose, the route, and the frequency of administration. We'll look at the second medication, Fairlicid. That is the name of the drug. The dose is 125 milligrams. It's to be administered IV every day. In the hospital, typically daily meds are going to be timed from 0-900. This particular medication also gives you some extra information. It's an IV medication, and so it tells the nurse that they're going to infuse this drug over 60 minutes. This is something that, as a nursing student or a nurse, you would then validate in the drug book. Another piece of this MAR is the start-stop date. If you look on the corner, in the blue bar, another component of the MAR are the start-stop dates. If you look at the blue bar, you will see it says start, stop, and status. Under that, each order has its start date and time, and whether it's an active order or not. All 4 of the drugs we're looking at now state that they are still active. Many drugs do not have a standard stop date. However, there are some exceptions to that. Narcotics, for instance, and antibiotics. Typically, those are going to have set stop dates based upon the facility's policies and procedures. The reason behind that is that those medications in particular. The reason behind that is that those medication classifications in particular need to be administered carefully. These are not medications that need to be ordered once and then left on a patient's profile indefinitely. By having standardized stop dates, it triggers the prescribers to re-examine and evaluate whether those drugs need to be continued or if it's appropriate to stop them. This screen is just a little bit larger and allows you to see a little better in more detail the individual medications. This screen is just a little bit larger and allows you to see a little more detail on what the medication section of the MAR would look like. Your book discusses 6 rights of medication administration. Those are very important. These rights are the foundation of medication administration. In order to safely administer medications to a patient, we must ensure that these rights are always upheld. The first right is the right patient. The second is the right medication, the right dosage, right time, right route, and right documentation. Most of the time, if a med error were to happen, it's because one of these 6 steps or 6 rights were violated. Perhaps a medication was given to the wrong patient. Perhaps the wrong dose of the medication was given. It's important to adhere to these principles as you begin the medication administration process and throughout your career in order to ensure that you are promoting the safety of your patients. Your book also describes 3 other rights that are also important. All patients have a right to refuse. So if you enter a room and a patient has been prescribed something that they don't wish to take, they can say no. There are 3 other rights that your book describes. The first is the right to refuse. A patient, as long as they are in, a patient always has the right to refuse a medication. For instance, if I were to enter a patient's room with a sleeping pill because it was ordered at 2100, the patient can tell me, I don't ever go to bed at 2100. For example, if I were to enter a patient's room with a 9 o'clock the right reason. Medications must be given for the right reason. An example of this would be sedatives. The right reason. It's important that medications are given for an appropriate reason. For instance, we would not give a sedative hypnotic med in order to just help a patient sleep because we don't want to be bothered and have to answer their call light all night. That would be a form of chemical restraint, and an inappropriate reason for the administration of that classification of med. Patients also have the right to know. This means that a patient needs to be educated about every medication that is being administered to them. So, what information do you need to know before you give a medication? We're going to break this down into two categories. The first is patient information, or what you need to know about your individual patient prior to beginning the med administration process. And the second is the drug information. So what do you need to know about each of the drugs that you're going to administer in order to do so safely? I want you to write down 5 things that you think a nurse needs to know about the patient before they begin the medication administration process. Pause the PowerPoint and do so now. Thank you. We will discuss a few of those things now. The first is they need to know the diagnosis of the patient they're caring for. So why is the patient in the hospital? In addition to that, you need to know what is the primary diagnosis, but does the patient also have secondary diagnoses or comorbidities? So for example, I may be caring for a patient who was admitted with pneumonia, but the patient also has a history of diabetes, hypertension, and coronary artery disease. So while our acute concern is the pneumonia, we will also be administering medications to treat the other conditions the patient suffers from. Another factor that's important is the patient history. So in the example I just used, part of that history would be those secondary diagnoses, so the hypertension, etc. Another factor you need to know are allergies. What is your patient allergic to? And are they truly allergies, or are they simply adverse reactions to a medication? Many times a patient will state an allergic reaction, and when you investigate, what they actually have is a side effect of the medication. For instance, nausea. Many meds can cause nausea. That is not a true allergic reaction to a medication. That is simply a side effect. Weight would also be an important factor to know. As you proceed through the program, you're going to see that many meds are administered on a weight basis. So, pediatric meds and critical care meds would be examples of that. You also need to be aware of whether or not a patient can swallow. An example of a time this would be very important is an example of a time where this is extremely important would be if you're caring for a patient who's had a CVA or stroke. Many times their ability to swallow safely is impaired by the stroke. If you have a patient who is suffering from a swallowing problem and they have 15 oral meds prescribed, then it's important that you reach out to the prescriber and see if those routes can be changed. You also need to know whether or not a patient can take meds orally. Many times a patient will be on NPO status or nothing per os. This means that they cannot take anything orally. There are exceptions. Sometimes you will see it written as NPO accept meds. In that instance, it is okay and recommended that Sometimes you will see it written as NPO accept medications. In that instance, they are not going to be allowed food or drink, but they may take their oral medications with a few sips of water. You also need to know your patient identifiers. In the hospital, we typically use the patient's name and date of birth. This is found on the patient's armband as well as on the medication administration record. Age is another component that's important. As you've learned, as a patient ages, their body is going to metabolize medications differently due to age-associated changes. You'll learn more about this in pharmacology content. Now, I want you to write down at least 5 things that you need to know about your medication prior to administration. Pause the PowerPoint and do so now. Thank you. There are quite a few things that it's important to know. We're going to cover some of the main issues, but be aware this is not necessarily an all-inclusive list. One, you need to know what is the medication going to do, or its therapeutic effect. You also need to be aware that many drugs have multiple therapeutic effects. An example of this would be aspirin. Aspirin can be given for a variety of reasons. We give it as an antipyretic to bring down fever. We can use it as a pain reliever. We can use it as an anti-inflammatory. We can also use it as a platelet aggregate inhibitor. Many times, the dose is what's going to trigger the patient's history, and the dosage prescribed will help you identify the reason that the medication is being used in each patient's situation. For example, if I have a patient who's running a fever, I may give aspirin to counter the fever. However, I'm not going to give a baby aspirin or 81 milligram aspirin to do that because it would be ineffective. As a nurse, it's important to realize that if I see an order for a baby aspirin or 81 milligram aspirin, that it is most likely being given for its platelet aggregate inhibition function. So the takeaway is that you have to understand why your particular patient is taking each medication. You also need to understand the action. That's the way in which the medication is going to work. We'll talk more about this in a little bit. Some other important factors include the dosage. Is it safe? Several years ago, when my oldest child was a toddler, she had an ear infection. My husband took her to the doctor and went to the pharmacy and picked up the prescribed antibiotic. When he got home, we were all in the kitchen and he decided he would give the first dose. I saw him get the medication out of the fridge, shake it up, and begin to measure it into the measuring device. And he was pouring and pouring and pouring. And as a nurse, even though I don't work pediatrics, I knew that the dose he was pouring out was quite a bit more than my toddlers should take. So I stopped him as he was preparing the medication, and I asked him how much he was giving. He looked at the bottle and he said he was giving 5 tablespoons. I immediately said, that's not right, knowing that with the particular antibiotic he was giving, a few years ago, when my oldest daughter was a toddler, my husband took her to the doctor and she was diagnosed with an ear infection. They then went, picked up the antibiotic, and came home. As we were standing in the kitchen, he got out the antibiotic and began to administer the first dose. He pulled out one of the medication syringes that we kept in the kitchen cabinet, and he started to draw up the medication. I was in the kitchen and I was paying a little bit of attention to what he was doing, enough to realize that the amount he was pulling out was a whole lot more than my toddler should receive. I stopped him and asked him what he was doing, and he told me he was drawing up the dose. I said, how much are you giving? He told me what it was, and I said, that's way too much. That's probably multiple times the dosage she should receive. He then handed me the bottle. I read it, and it was in fact mislabeled. He had drawn up the correct amount, but it was many times the correct dosage. I then called the pharmacy and let them know that there was an error on the packaging. In this instance, I happened to be there, and as a nurse, I knew something wasn't right. However, if my husband had given that first dose while I wasn't at home, he would simply have given what the bottle said to, never questioning it. So, as a nurse, it's extremely important that you understand what the safe dosage range for medications are prior to administering them. You also need to know what are the common side effects. Are there any severe or life-threatening side effects? In addition, are there contraindications? For example, if I'm taking care of a patient who just had surgery or a hemorrhagic stroke, for example, I would not want to administer an anticoagulant that would promote bleeding. You also need to be aware if there are drug-drug interactions or drug-food interactions. Many medications need to be either taken with food or taken on an empty stomach. It's important to understand that because in most cases, that is going to change the rate that the medication is absorbed by the patient, or it can alter the effectiveness of the medication. Some common drug-food interactions would be grapefruit juice and statins, Claritin and citrus fruits. So be aware that those do exist and you need to be knowledgeable about what those common interactions are. You also want to make sure that the medication is appropriate to the patient's diagnosis and history. In the hospital, we've been giving meds with students, and as we prepare the medications, we look at a med and it really doesn't make sense. You also want to make sure that the medications that are ordered are appropriate to the patient's diagnosis. Remember that even though we're using computerized medication administration systems, it's human beings who input the data. Physicians are inputting orders, and pharmacy techs many times are transferring the orders into the MARS. We all know that data entry errors happen because of human error. We all know that data entry errors can occur. It's important as you look at patient medications to ask yourself, is it appropriate for this patient to be receiving this medication? A few semesters ago, I was giving meds with a student in the clinical setting. We had the MAR pulled up, we had checked the orders, and we were getting ready to get the medications out of the Pyxis system. As we were reviewing the list, a certain med stood out as being a little weird. As we were reviewing the medication list, I noticed that there was a medication among them that didn't seem to make sense for the patient's history or diagnosis. I asked the student if there was some particular reason the patient would be on it. The student said not that they were aware of. So we then checked with the nurse. The nurse also said she did not know a reason that the patient would be receiving that medication. When we further investigated, it turned out that it was not truly a medication that patient was supposed to receive. The order had been put into the wrong chart. So again, in that instance, it was simply a human error, a data entry error. However, if we hadn't questioned that order, the patient would have continued to receive a medication that they were not supposed to have. You also want to know if there is any associated lab data. A common lab that you look at would be potassium when administering the furosemide. Furosemide is a diuretic, and it can cause a patient to lose potassium. Anytime you give furosemide, you want to check the most recent potassium result. If their potassium is too low, it's important to understand that we need to hold that particular drug. Other types of labs that are related to medications can include peaks and troughs of antibiotics and therapeutic levels for certain drugs. Again, you'll learn more about these particular drugs and lab levels in pharmacology content. Other important components about the drug would be associated assessments. For example, if I'm giving a beta blocker, I know that I need to assess the pulse prior to administration. If I'm giving an antihypertensive, I know that I need to assess the blood pressure prior to administration. Patient teaching and education. So what do I need to make sure the patient understands about each drug prior to administering them? What's the route of administration and how is it going to impact the way I give this drug? Is this a drug that I can break if the patient can't swallow it whole? Or can I crush it if necessary? There are certain types of drugs that you cannot break or crush. Typically, those would include anything that's enteric coated or anything that's sustained or extended release. Because if you damage the coating, it's going to alter the way the drug is released into the patient's system, thereby bypassing the time release mechanism and giving the dose as a single bolus. Other things you need to know are, is the drug high alert? or is it a controlled substance? As a student, typically, we do not want you administering controlled substances in the clinical setting. Your clinical faculty will give you more information about this prior to clinical. Now we're going to look at the alert form. If you look on your Blackboard course shell, you will see that I loaded a blank version of this form for you. Please make sure that you have printed this off so that you can follow along through the next few slides. If you haven't, pause the PowerPoint and please print it now. We're going to take a few minutes and we are going to review Davis Drug Guide, which is your medication administration textbook for this program. And we're going to review the Davis Drug Guide, which is your medication administration guide for this program. We'll look at a drug and go through the different sections of the guide. I'll help you identify what information is important, what's pertinent, and where you'll find it in the drug guide itself. It's important that you become familiar and comfortable using your drug guide. You need to be able to navigate it well and quickly find pertinent information prior to administering medications. We're going to begin with the drug metoprolol. If you look at the screen, you will see that in blue, the name is highlighted. Many meds have names that are difficult to pronounce. The drug guide provides a pronunciation guide for you. In this instance, this drug is pronounced metoprolol. Immediately under that, you'll see that there are several brand names that this drug is sold under. Immediately under the generic name metoprolol, you'll see that this particular med is sold using several different brand names. Those that have the maple leaf next to them are the Canadian products. The ones that I've highlighted in yellow are the American brands. So you may have a patient who tells you, I take Toprol XL. You need to be able to identify that Toprol XL, you need to be able to identify the fact that Toprol XL is an extended release form of metoprolol. In pink, you'll see that I have highlighted the classifications. You'll also note that there are two different classifications listed. The first is the therapeutic. That tells you what the drug is going to do for the patient. In this instance, metoprolol is an anti-anginal. In this instance, metoprolol is an anti-anginal, which means it helps alleviate chest pain. It can also be used as an antihypertensive to lower blood pressure. The pharmacologic classification is beta blocker. It's important that you're aware of both types of classifications. If you'll look at the bottom of your screen, you'll see that I have filled out the first column of your alert form with that information. The classification, anti-anginal, antihypertensive, and then the pharmacologic classification, beta blocker. The generic name, metoprolol, and the trade name, low pressor or Toprol. I did not include the Canadian brands since you typically will not be administering those. The next column on your form is the action, and so you will see that I've highlighted that in pink on your screen. The action of a beta blocker is described in pink. You will see, if you read across, it also gives you the therapeutic effects. So in this instance, that includes decreased blood pressure and heart rate, decreased frequency of attacks of angina pectoris, decreased rate of cardiovascular mortality and hospitalization in patients with heart failure. So those are the therapeutic reasons that a patient could receive metoprolol. If you look above that, you will also see indications. So this is basically just telling you what types of disease processes would it be appropriate to prescribe this medication in. You will also see that on the second line under indications, it gives you a line titled unlabeled use. That means that this drug can be effective for those particular processes, but it is not marketed directly towards those. In this column, under A for action, I have summarized the information that we just discussed. So I included the indications and the therapeutic effects. The next column we'll look at is lab data. Under the nursing implications section of your drug guide, you will see that there is information on lab test considerations. I've highlighted that in blue on your screen. So for this particular drug, metoprolol, you can see that it can increase the BUN. So for this particular medication, metoprolol, you can see that it may cause the BUN to increase. It may also increase the serum lipoprotein, potassium, triglycerides, and uric acid levels. It can increase ANA titers, blood glucose levels, as well as liver enzymes. Under this column, I've taken that data and entered it. The next column we'll discuss are the side effects. Under the drug guide's adverse reaction side effects section, you can see that the drug guide breaks things down by body system. The first system, which I've highlighted in teal, is the CNS. The first system that I've highlighted in blue is the CNS, or central nervous system. You will also see that I've highlighted two particular side effects in that body system in purple. Those are underlined. In your drug guide, when you see an underlined side effect, it means that it's one of the most commonly reported side effects of the particular drug you're looking at. If you read across the screen, you'll also see that I've highlighted several words in yellow. When you look in your drug guide under this section, when you look under this heading in your drug guide, you will note that certain side effects are listed in red. Typically, in a drug guide, when you see that red text, it means that these are considered life-threatening side effects or adverse reactions. In this case, bradycardia, heart failure, and pulmonary edema. So, on this column, I have listed in bold the life-threatening problems and then the most commonly reported side effects as well. So in this column, I have included the life-threatening adverse reactions or side effects in bold text, and then I also included the most commonly reported side effects, which were those that were underlined. The next column that we're going to address are the assessments, or the R column for review. The next section we're going to continue in the column labeled E for evaluate. So in addition to the side effects that we just listed of fatigue, weakness, erectile dysfunction, bradycardia, heart failure, and pulmonary edema, there are also certain things that are listed under contraindications and precautions. If you look at your slide, you see that I have that highlighted in blue. Again, as you glance at this, you're going to see that there are several things listed in red. Those things in red are always going to be important considerations for you to know. Here, it's telling you that in the geriatric population, they're going to have an increased sensitivity to beta blockers. Therefore, dose adjustment may be recommended. It also states that pulmonary disease, including it also tells you that this drug should be used with caution in patients who are pregnant, lactating, or in children. As you can see, it says that safety is not established. I go ahead and I include those major considerations under the E or evaluate side effects column. Next, we'll look at the assessments required for this particular medication. Again, in the drug guide, you're going to go back to the nursing implications section. Here, I've highlighted the word assessment in pink. You'll note that I've also highlighted down under implementation several lines, again in pink. So this is the information that as a nurse I need to know prior to administering this medication. I need to monitor the blood pressure, the ECG, and the pulse frequently during the dose adjustment period of time, as well as throughout therapy. I need to monitor vital signs, monitor intake and output, daily weights. I need to assess for signs and symptoms of heart failure, and then it lists those particular symptoms. Down under the implementation section, you can see that next to PO, it says take apical pulse before administering. If less than 50 beats per minute, or if arrhythmia occurs, withhold medication and notify the healthcare provider. This is extremely important. That tells you prior to administering this beta blocker, metoprolol, I would have to assess an apical pulse for a full minute. Many of your electronic medication administration records will trigger you to enter that data prior to administering these types of drugs. You will also see that there is a high alert on this drug, and it tells you do not confuse Toprol-XL with Topamax. Do not confuse low pressor with Lyrica. Do not confuse metoprolol tartrate. Do not confuse metoprolol tartrate with metoprolol succinate. It's important that you read these sections and understand them. Another piece of important information is below. Another piece of important information is that this drug needs to another important piece of information is that metoprolol needs to be administered either with meals or directly after eating. It also states that if using the extended release tablets, they need to be swallowed whole. They cannot be broken, crushed, or chewed. Again, I have summarized that important data and I've included it in the R column. Next, we'll look at patient teaching. In your drug guide, you have a section called Patient Family Teaching. Again, we see that there's red text. Again, we find red text. Anytime you see red in the drug guide, it's important information that you read. Here, it's telling us that abrupt withdrawal may precipitate life-threatening arrhythmias, hypertension, or myocardial ischemia. Again, those can all be life-threatening events. Below that, it also in red states that the patient needs to notify their healthcare provider if their pulse is slow, if they have difficulty breathing, wheezing, cold hands and feet, dizziness, lightheadedness, confusion, depression, rash, fever, sore throat, unusual bleeding, or bruising. It's important that these things be taught to the patients, especially if this is a new drug that they've never taken before. You will see that there's also other information that's not read. That means it's still important, it just may not occur. So it's still important, it just may not have life-threatening implications. For instance, on this, it's warning diabetics that they need to closely monitor blood glucose levels. It also warns to minimize caffeine intake. Again, I have summarized that data that we just read and included it in the teaching category. I also included a little bit of the data we looked at previously about not crushing, breaking, or chewing the extended release, taking the med at the same time each day, and not skipping doses. As you move through the program, you will continue to use the alert form. It's important that you become familiar with it and keep these because you don't want to, it's important that you keep these forms because you don't want to duplicate work if at all possible. As you continue to build your portfolio, you will continue to build a medication portfolio as you go through the program. This will eliminate duplication of work. Now, we'll talk about the actual process of administering medications briefly. There are 3 medication checks that must occur prior to administering any medication. The first is going to always happen while you are preparing the medication. This can be while you're taking it out of the medication Pyxis, Omnicell, or cassette, or wherever the medications are stored at the facility you're doing clinical. The second medication check occurs when you're actually preparing the medication itself, i.e. putting it into the cup, pouring it, or drawing it up if it's a parenteral medication. The final check always occurs at the bedside before opening and administering the medication. Now, occasionally, you may use a multi-dose medication, such as a cough syrup. In this instance, the third check would be before you return the bottle to the storage area. In that instance, you would always label the cup. The third med check will always happen at the bedside before opening and administering the medication. Many times I've gone into a room to administer medications, and as I go through the process, the patient informs me that there's one or more medications that they don't want to take. It's important that I know that prior to scanning and opening the medications. Therefore, you don't want to scan and Therefore, you never want to open your medications prior to scanning them and validating that the patient is indeed going to take them. Next, we need to discuss patient identifiers. These must be utilized every time a medication is given. Doing this will decrease the risk of medication errors. So, you will check the name band. You will have the patient state their name and date of birth. You will make sure that as they stated, it matches what's on the name band. You will also have the MAR pulled up, and you're going to verify. You will also have the MAR pulled up on the computer at the bedside, and you will again verify that what the patient stated matched the ID band, and what's on the ID band matches what's displayed on the MAR screen. Finally, we're going to discuss the medication reconciliation process. Over the years, medication reconciliation is a process designed to decrease the number of medication errors that occur in a hospital setting. Research has shown that there are 3 times during a hospitalization where it is likely for a medication to either be added inadvertently to a patient's medication administration record or to inadvertently be dropped from one. Those times are on admission to the hospital, prior to the transfer to another unit, and prior to discharge. Because the research has shown this, it's important that as a nurse, we ensure that we are carrying out the medication reconciliation process at each of these phases of the patient admission. As a patient is entering the facility, the admitting nurse is going to do the first medication reconciliation. During this med rec, the nurse is going to ask the patient all the meds they take at home. They will then enter that into the medication system of the EHR they're using. They will then enter that data into the electronic health record that their facility uses. Those meds will then be validated by the prescriber, and the prescriber will decide whether to continue the medications, discontinue them, or change the dosage. This procedure will be repeated anytime a patient is moved from one unit to another, for instance, from the ER out to a med-surg floor, or, for instance, from ER to a floor to ICU, ICU back to a floor, and then prior to discharge. Thank you for participating in this lecture. That concludes this presentation. If you have any questions, don't hesitate to reach out via Blackboard. Thank you.